Good morning, everyone. Welcome to our webinar, Smoke-Free Caribbean, a win-win for health and the environment. We're going to give it about a minute for people to join, and then we will get started. Okay, good morning, everyone. Good morning again. Welcome to this webinar, A Smoke-Free Caribbean, a win-win for health and the environment. The webinar is jointly hosted by the Pan American Health Organization, the University of the West Indies Cave Hill Campus Law and Health Research Unit, the Caribbean Public Health Forum, Law Forum, and the Healthy Caribbean Coalition. My name is Maisha Hutton. I'm the Executive Director of the Healthy Caribbean Coalition, and I will be your moderator today. The webinar is being held in celebration of World No Tobacco Day. The theme is protecting the environment, and the title again is A Smoke-Free Caribbean, a win-win for the health and the environment. The objective of the webinar is to support CARICOM countries in achieving the goal of 100% smoke-free Caribbean by 2022. And we are also delighted that we will be launching 6 publications to support smoke-free legislation across the region. A quick housekeeping note, please use the Q&A function for questions, and our panelists will answer your questions in real time. We have a packed agenda today, as you can see, many speakers, many panelists. We're going to kick it off with brief opening remarks from partners, and I will hand over to Sir Trevor Hassell, President of the Healthy Caribbean Coalition, to get us started. Sir Trevor.
So thanks very much, Maisha. And let me start by adding my welcome on behalf of the directors and members of the HCC. Today's webinar is one in a long list of tobacco control activities undertaken by the HCC and its member organizations, as the HCC has really sought to play its part in the Caribbean becoming a smoke-free zone. Over the years, the HCC has provided the regional civil society dimension as Caribbean governments have sought to develop, to implement, to update, and to review comprehensive multi-sectoral national tobacco control strategies, plans, and programs in accordance with the FCTC and its protocols. The issue of tobacco control in the Caribbean has been from the inception a priority for the HCC, recognizing as we do the significant role of tobacco as a major NCD risk factor. You know, in fact, I recall that tobacco control featured significantly in the HCC's first Facebook post in October 2010, and in the first edition of the HCC News Roundup in March 2013. Since those years, the HCC has hosted and been a resource at several tobacco control conferences and workshops, undertaken several tobacco control advocacy initiatives, conducted a text to quit mobile phone campaign, produced a report that documents best practices of the JCTC and other Caribbean CSOs in the implementation of tobacco control measures, collaborated in an initiative to mobilize Caribbean cancer societies around tobacco control in an American Cancer Society project known as Prevent 20, and most importantly, HCC's regional tobacco control program has benefited significantly from the contribution of Barbara McGaw, who's on the call, who has been HCC's tobacco control policy advisor since at least 2017. Today's webinar, at which we launch, as you heard earlier, together with PAHO, UE Law, and the Caribbean Public Health Law Forum, 4 intersectoral policy briefs towards a 100% smoke-free Caribbean, and 2 case studies on the implementation of the FCTC, is then but a continuation of the HCC's tobacco control efforts and a contribution to the acceleration of member state action towards a smoke-free Caribbean. I hope these excellent resources, which I commend to you, released ahead of the World No Tobacco Day 2022, will be useful tools for Caribbean governments and tobacco control civil society advocates. Thank you.
Thank you, Sir Trevor. I'd now like to hand over to Dean Chambliss. He is the Sub-Regional Program Director for the Caribbean at PAHO.
Good morning. Can I confirm, please, that my audio and video is working? I seem to have some delay on my end.
Yes, we can hear you and we can see you.
Okay, excellent. Thank you so much, Mancha. I appreciate that. Perhaps my slow IT system. Good morning, colleagues. It continues to shock me that tobacco is the only legal consumer product that kills close to half of its users when it is used as intended by its manufacturers. Tobacco's grave impact on public health continues to be devastating, with approximately 8 million global mortalities from tobacco use each year. This equates to about 1 million lives lost in the region of the Americas. Today, we are here to highlight yet another concerning toll associated with the use of this addictive drug: tobacco's devastating impact on human health through environmental degradation. From tobacco's cultivation to its production, distribution, and disposal, its toxic effects on the environment require our urgent attention. This is what makes the theme for this year's World No Tobacco Day observance so important. Tobacco, Threat to Our Environment, aims to raise awareness of the environmental impact caused by tobacco production and consumption, and provides yet another compelling reason for tobacco consumers to quit smoking once and for all. This is of grave importance. Each year, close to 600 million trees are cut down to make 6 trillion cigarettes, contributing significantly to deforestation on a global level. It is also important because 32 million tons of tobacco leaves are grown to produce those same cigarettes. Studies show us that this results in over 80 million tons of carbon dioxide emitted into the atmosphere annually. To make matters worse, some 4.5 trillion cigarette butts are discarded globally, making them the most littered item on Earth and the most frequent item of litter on our beaches. This problem is further exacerbated by the production of newer nicotine and tobacco products, including e-cigarettes. These products have not only contributed to addiction in a new generation of smokers, but also caused significant electronic waste, thereby increasing the industry's harmful ecological footprint. Consequently, we need new collaborative efforts to advocate for the reduction of tobacco consumption. Collaboration between grassroots voices, civil society, governments, and international organizations can collectively change both policies and consumer habits. This will positively impact our health and protect the environment. To this end, this webinar is a positive step, engaging in discourse and raising awareness of the negative environmental impacts of tobacco. The implementation of a smoke-free Caribbean will lead to healthier people in healthier settings. Accordingly, PAHO has undertaken many direct anti-tobacco interventions and continues to support the development of legislation and policies in the Caribbean to advance the smoke-free mandate. Regionally, Caribbean ministers of health have endorsed the PAHO strategy and plan of action to strengthen tobacco control in the region of the Americas. This includes the aim of a 100% smoke-free environment throughout the Americas by 2022. In 2018, CARICOM heads of government supported the use of the tagline, CARICOM, a region free of tobacco smoke by 2022. Later in 2018, the heads of government renewed the region's commitment to establishing and maintaining a smoke-free status. Though most Caribbean member states are signatories to the WHO Framework Convention on Tobacco Control, or FCTC, the implementation of effective tobacco control measures in the region has unfortunately lagged. On behalf of PAHO, I therefore appeal to CARICOM countries to implement their commitments to a 100% smoke-free environment, further to their obligations under the WHO FCTC. Though 2022 is well advanced, we urge those who have not yet put in place smoke-free policies to do so, making a decisive step to save lives and protect the environment. In closing, I reiterate how crucial it is for us to collectively act to curb the effects of the tobacco industry on human health and the environment. Through the implementation of smoke-free policies and effective enforcement mechanisms, we can move from intention to action. I look forward to our discussions today because I know that through this collaborative discourse, we can inspire healthful change. Thank you very much, and back to you, Masha.
Thank you, Mr. Chambliss. Excellent opening remarks. And now I'd like to turn the mic over to Dr. Joyce St. John. She is the Executive Director of the Caribbean Public Health Agency. Dr. St. John.
Thank you so much, Madam Moderator. Good morning to all. Can you join me as I imagine what the smoke-free Caribbean in 2025 or 2030 would be like? In the smoke-free Caribbean, as tobacco use alone accounts for 1 in 6 of all deaths resulting from NCDs, all of those people will be alive with their finances greatly improved from not buying 5 to 10 packs of cigarettes every day. 2 out of 3 new cases of NCDs will not happen, and all of those visits to the polyclinic or private doctor or emergency department will not occur. So many more families will have a better quality of life because money does not have to be diverted to paying for medical care. The hospitals will not have to amputate as many limbs due to less cigarette smoke-induced peripheral artery disease. The Ministry of Health won't spend as much on radiation or chemotherapy for the cancers that won't develop. But let's not forget all those people who don't smoke but get ill from secondhand smoke, like the spouse of a chain smoker. Their risk of cancer, emphysema, or heart disease will be significantly reduced or even eliminated. What about the smokers? Almost immediately, someone who stops smoking stops coughing and fighting for breath as much when they exert themselves. Their breath and clothes will smell better and their skin will improve. There'll be more energy to work and more money to spend or save. The environment will be less polluted with cigarette butts and discarded packaging, and the air will be fresher too. CARF is concerned that the tobacco industry is advertising to target young people, to encourage them to engage in cigarette smoking or vaping. The younger they start, the sooner they become ill. In particular, young women are increasingly becoming smokers to be cool, but there's nothing cool about the reduction in productive years of life and the increase in mortality statistics. Imagine finding out that smoking makes it difficult to have a child. During the pandemic, the SARS-CoV-2 virus disproportionately attacked people with NCDs and risk factors, including smoking. A 2021 study in Jamaica stated that 95.3% of people who died from COVID-19 had 1 or more comorbidities or risk factors, of which chronic smoking was among the top listing. This is why CARFA wants the unnecessary suffering to stop. I look forward to the webinar outlining concrete, achievable next steps in our collective efforts. We must make the Caribbean a smoke-free region. Thank you.
Thank you, Dr. St. John, for painting a picture of what the Caribbean would be like, the tobacco-free Caribbean, where we're really aiming to go. And I'm going to hand over now to Dr. Karen Gordon-Boyle, who is the Program Manager at the Health Sector Development Unit at the CARICOM Secretariat. Dr. Gordon-Boyle.
Thank you very much, and good morning to my fellow panelists and to the participants. It is with great pleasure that I join my voice with yours as a representative from the CARICOM Secretariat to reiterate our commitment in this ongoing fight to ensure our region is a smoke-free one. At this time, every year we join the World Health Organization to remember and honor countries, organizations, and people who demonstrate their commitment to freeing our environment from the added pollution derived from first, second, or third-hand smoke. This year, we focus on the threat of the tobacco industry, not only to the health of people, but to our environment. With an annual greenhouse gas contribution of 84 megatons of carbon dioxide equivalent, the tobacco industry contributes to climate change and reduces climate resilience, wasting resources and damaging ecosystems. It is estimated that about 3.5 million hectares of land are destroyed for tobacco growing every year. Tobacco growing contributes to deforestation and soil degradation. We must continue to campaign for the reduction in tobacco consumption, as this is a step to achieving the Sustainable Development Goals. I take this opportunity to remind member states of our commitment in September 2017, when our ministers of health endorsed the PAHO strategy and plan of action to strengthen tobacco control in the region of the Americas, 2018 to 2022. Our ultimate goal was for a 100% smoke-free environment throughout the Americas by, no, not the next 10 years, but this year, 2022. CARICOM member states, as parties to the World Health FCTC, have committed to implementing its measures within the first few years of signing the treaty. And yet there are some 7 countries that are yet to implement comprehensive smoke-free legislation. Additionally, there are serious gaps as it relates to the enforcement in the countries which have implemented smoke-free legislation. Member states are therefore urged to adhere to their obligations in keeping with the regional commitments and international obligations. This is 2022, and we still have a way to go. In our efforts towards achieving smoke-free spaces, member states are urged to implement Article 13 of the World Health FCTC by placing a complete ban on tobacco advertising, promotion, and sponsorship. Our very own CrossQ is in the process of preparing a regional standard for tobacco advertising, promotion, and sponsorship to meet the requirements of Article 13. I therefore take this opportunity to congratulate the Healthy Caribbean Coalition, the Pan American Health Organization, the Caribbean Public Health Law Forum, the University of the West Indies, CARFA, the Health Research Unit, for jointly organizing and hosting this webinar under the theme or banner, A Smoke-Free Caribbean, a win-win for health and the environment. I wish you all success in achieving the objectives of this webinar, which will generate the tools and templates that can help our member states in developing their legislation and policies. I thank you all for your continued commitment to our regional efforts. And I firmly believe that with your support and the support of our international development partners and the renewed commitment from our member states, we can still achieve our commitment this year, 2022. I thank you. Best wishes.
Thank you, Dr. Gordon-Boyle. And on that note about tools and resources, how do we get to 100% smoke-free Caribbean? I'd like to hand over to our last speaker, who is Mr. Jorge Cardenas. He is the technical advisor on tobacco control for the Americas for the International Union Against Tuberculosis and Lung Disease, otherwise known as the Union. And a special thanks to the Union for funding the development of the tools that we will launch later on in this webinar today. Over to you, Jorge.
Thank you very much, everyone. Good morning. On behalf of Gustavo Soñora, who is the Regional Director for the Latin America and the Caribbean at the International Union Against Tuberculosis and Lung Disease, I am Jorge. At the Union, we are very glad to have been part of the efforts that will be presented today. For us, it is a fact that the Caribbean is a key region on tobacco control. And therefore, recently, we have been supporting the tobacco control agenda in the Caribbean under a couple of grants. The publications that will be presented today were possible with support and funding by the Bloomberg Initiative to Reduce Tobacco Use under a grant managed by the Union. The launch of 6 tobacco control publications, including case studies and policy briefs, was achieved in close collaboration between PAHO, the Healthy Caribbean Coalition, the Caribbean Public Health Law Forum, the University of West Indies, under the Union grants called Accelerating Progress Towards 100% Smoke-Free Caribbean by 2022. Actually, the creation of the Caribbean Public Health Law Forum, which was launched in June 2021, has been made possible through the support of such grant. So let us enjoy this webinar and remind CARICOM leadership of their 2017 commitments to achieve and keep a smoke-free Caribbean. Thank you.
Thank you, Jorge. I'm now going to hand over to Ms. Cheryl Dennis Wright, who is the consultant on NCDs and mental health for the PAHO WHO Subregional Office here in Barbados. Cheryl is going to present on a smoke-free Caribbean. Where are we now?
Good morning. Good morning to you, moderator. I'm gonna share my screen even now at this time. Yes, so good morning to you, moderator. Good morning to the esteemed panelists and to also our esteemed partners, and certainly to you, our participants. So we're looking at the picture of a smoke-free Caribbean. Where are we now? And much of the context has already been discussed. However, as they say, a picture is worth 1,000 words, and therefore I'm going to take you through to where we are so that you can actually see. Now, in terms of international treaty or international commitment, it's important for us in determining where we are, and in order for us to understand where we are, it's also important for us to look at where we're coming from. And therefore, it started from the commitment under the WHO FCTC, where CARICOM states, and let me mention that all CARICOM states, with the exception of Haiti, are signatories, are parties to the WHO FCTC. In fact, under the FCTC, there are time-bound provisions, and these time-bound provisions provide for the implementation of Article 8, which speaks to putting in place a smoke-free environment, whether it is smoke-free workplaces, outdoor public places, and so on. And remember that I said that these would have been time-bound. So there is there is a requirement on these parties to ensure that these measures are put in place just within a few years of implementation. And you can see from this slide that all the parties would have been in breach of that or of those timelines. Nonetheless, there is hope. As it relates to the commitment, so there's not just a commitment on the treaty, but there have been some regional commitments, some of which you would have heard from some of our valued partners who spoke earlier. So there is the CARICOM commitment that took place in July 2017 at the 38th regular meeting of the Conference of Heads of Government of CARICOM states, where member states via Decision 12 supported the use of a tagline, CARICOM, a region free of tobacco smoke by 2022. At regional and national levels, which all governments, departments, civil society organizations, and private sector businesses would be encouraged to use. That's the timeline that they had put in place, not just the timeline, but in terms of the commitment to ensure that that tagline is used. And again, in 2018, the heads renewed the region's commitment to establishing and maintaining a smoke-free status. Again, later in September 2017, so this is after the July commitment, Caribbean Ministers of Health endorsed the PAHO strategy and plan of action to strengthen tobacco control in the region of the Americas. And this plan of action was between 2018 and 2022, including 100 smoke-free or 100% smoke-free environments throughout the Americas by 2022. And as was mentioned, we are here. So that commitment still rings true and is still alive. Now, in terms of where we are, go back to this screen. In terms of where we are, you would have seen that Barbados, for instance, under the Health Services Prohibition of Tobacco Smoking in Public Place regulations, that was in 2010, they put in place smoke-free environments. Jamaica, by virtue of the Public Health Tobacco Control Regulations. Guyana, the Tobacco Control Act of 2017, Antigua and Barbuda Tobacco Control Act of 2018. We also have Trinidad and Tobago, St. Lucia, and we also have Suriname that had put in place in 2013, and we have St. Lucia that had put in place smoke-free areas in 2020. So we have 7 countries that have put in place smoke-free policies or smoke-free legislation. There is still work to be done in 7 other countries that are signatories to the FCTC. The Bahamas, for instance, Belize, Dominica, Grenada, Haiti, St. Vincent and the Grenadines, and St. Kitts and Nevis. And we'd like to believe, and we know based on our engagement with these countries, that there is work in progress. Let me also mention that the Caribbean region also lags in the implementation of other measures which are complementary to the smoke-free environment. And you'd have heard mention also Article 13, which is quite an important treaty that quite an important article of the FCTC, which speaks to the prohibition on all forms of tobacco advertising, promotion, and sponsorship, which is also critical and complementary to the smoke-free agenda. However, our focus today is really on, on Article 8 or on smoke-free policies. And let me mention that PAHO has put in place, even via the Empower package, to help countries to be able to fully implement their obligations under the WHO FCTC. When I mention here that there is work in progress, we are also actively reaching out in terms of assisting as it relates to capacity building, as it relates to technical resources to help these countries. I know also that PAHO was actively and still is actively engaged currently with Dominica and also some of the countries that you see listed here. We have been reaching out. So I'm coming to a close, and I just want to reinstate PAHO's commitment. In fact, or to reinforce rather PAHO's commitment. In fact, in 2021, the director sent a letter to the member states within the sub-region reaffirming PAHO's commitment to providing technical cooperation. And often we have seen technical cooperation by virtue of capacity building and other technical support. There are consultants that are engaged from time to time to assist. That is what has been going on now. There is also support with respect to reviewing current legislative provisions to ensure that they are up to date and that they adequately address the obligations under Article 8 of the FCTC. So since we have, or since many countries have developed smoke-free policies, there has also been, a move to ensure that these provisions are adequately treated with, so that we're not just looking at smoke-free as it relates to cigarette, but we're also looking at, putting in place policies to treat with new and novel tobacco products to ensure that persons' health are safeguarded, and so that it's not just smoke-free as it relates to indoors, but we're looking at outdoors. I want to close by saying thank you very much. We look forward to further discussions in this session. And as we observe World No Tobacco Day, which is observed every year on the 31st of May, let us bear in mind that a Caribbean where there's no tobacco equals a healthier place and a healthier people. Thank you and enjoy the rest of today's session.
Thank you, Cheryl, for sharing with us where we are in the Caribbean, which countries have moved ahead and which ones are moving a little slower, but moving nonetheless. I'm now going to invite Mr. Danielle Lopez. He is the Senior Legal Advisor at the Campaign for Tobacco-Free Kids, and he is going to provide some perspectives globally on smoke-free legislation. Danielle, over to you.
Thank you very much, Maisha. I will share my screen now. Good morning to all of you, good afternoon and good evening. Thank you very much for the invitation for Campaign for Tobacco-Free Kids. It's a real privilege to be with you today. And for me especially, I'm very proud to join so many esteemed colleagues to celebrate the achievements of the Caribbean and to reflect on the challenge that might lie ahead. During the next 10 minutes, I will attempt to overview the implementation status of the smoke-free policy worldwide, noting how its progressive enactment has been a definite trend over the years all over the world. At this point, it should come as not surprise to anyone that tobacco smoke is harmful. There's several studies and research that actually prove that and prove that how smoke, secondhand smoke, contains a complex mixture of more than 7,000 chemicals, including about 70 known carcinogens, which are harmful for people's health. In adults, the exposure to secondhand smoke causes lung cancer, stroke, heart diseases. In children, secondhand smoke causes sudden infant death, low birth weight, impaired lung functions, and several other additional diseases that should be preventable if we as countries enact sufficient measures to actually avoid people to suffer from secondhand smoke. Given the dangers of breathing secondhand tobacco smoke, the duty to protect from tobacco smoke is implicit in every major human rights provision enacted all around the world. In fact, as you probably may remember, WHO FCDC preamble recall that the preamble of the Constitution of the World Health Organization states that the enjoyment of the highest attainable standard of health is one of the fundamental rights of every human being without any distinction of race, religion, political belief, economic or social condition. Therefore, the link between tobacco control, the enactment of smoke-free policies, and human rights, it's quite clear. And these considerations are at the heart of the provision of Article 8 of the Framework Convention of Tobacco Control, which explicitly recognizes the importance of protecting our populations from the danger of tobacco smokes and the importance of incorporating the development of scientific evidence to strengthen such protections. In particular, Article 8 of the Framework Convention for Tobacco Control established the obligation of parties to implement safeguards for the protection from serious effects of tobacco smoke, all in indoor workplaces, public transport, indoor public places, and, as appropriate, other public places. So, having framed our discussion, let's now review the status of the implementation of smoke-free policies all around the world and how different countries have implemented in their own legislations the provisions to assure that their own populations doesn't suffer from the dangers of the tobacco smoke. Per WHO account, as for 2021, at least 67 countries have already implemented complete smoking bans in their own jurisdictions. Let me please here highlight the case of South America as the first sub-region to fully implement, and as of regional level, as a complete smoke-free policy as of 2020, when Paraguay was the last country to actually join the rest of the South American fellow countries implementing smoke-free policies. Let me try to go back here. Yeah, in other words, as for 2021, those 67 countries assure that all the public places mentioned in this slide, these 8 public places that actually are assessed as smoke-free environments, were completely smoke-free or raise the percentages of their population that were potentially protected from smoke-free legislation up to at least 90%. 67 countries, at least 67 countries did that, and I will be telling you in a few minutes more what other countries joined these 67 countries after 2021. As you can see here, this trend, the progressive implementation of smoke-free policy has been a constant trend over the last 15 years. In fact, between 2019 and 2020, 5 countries joined the previous measure, and those countries were Ethiopia in 2019, Bolivia in 2020, Paraguay also in 2020, St. Lucia in 2020, and Jordan also in 2020. But as 2022, several countries have already implemented smoke-free policies. For example, in the case of Botswana, which in October of 2021 passed a very comprehensive law implementing smoke-free policies. Same case of Ukraine, which it's astounding the work that people in Ukraine has been doing, especially under the current grave circumstances that people are living there. Because there in January of 2022, they also passed a very comprehensive smoke-free policy. However, we will have to wait until the regulation implementing that law will be issued to actually assess how comprehensive it is. But anyhow, Ukraine have done a really good job trying to push forward the boundaries of the smoke-free legislation. Same case in Bosnia and Herzegovina, which in 2022 they signed and gazette their own tobacco control legislation just last week, and they also included a quite comprehensive smoke-free policy, which should be complemented by regulation. So we are still waiting to see how that development just move forward. But at the same time, probably those three countries, Botswana, Ukraine, and Bosnia, would add to these 67 countries that I just mentioned. So, but let me give you also example of countries that have done several additional things to move their smoke-free policies further than what's actually asked by the FCTC. So let's just review which countries have implemented an outdoor or quasi-outdoor smoke-free policy. And in this case, and per our own assessment, and invite you to go to tobacco control laws, our own website, where we have been putting all this information together. And from our assessment, per 2022, at least 94 countries have implemented in some way, in some way regulations or law that actually to establish smoke-free zones in outdoor sections and outdoor environments, going even further than what is required by the FCTC, which is quite interesting because there's no limit to countries to actually go further than what is stated by the treaty. What's happening in the Caribbean? I think Cheryl just covered in a very comprehensive way the developments in the Caribbean, so I will not go deep into what's happening in the Caribbean now, only just to reiterate how 7 countries have already implemented a very comprehensive smoke-free legislations, and just let me give a special recognition to each one of those countries, particularly the cases of Antigua and Barbuda and St. Lucia, whose case studies will be launched within the framework of this event. But however, as also was mentioned in the presentation that precedes me, there's much work to be done. And from CTFK, we are very committed to collaborating in everything to help to the Caribbean region to actually advance to implement a complete smoke-free policy within the next years. Before finish, let me give you a few final thoughts about this issue, and a few thoughts about how what we have learned from the whole worldwide experience about the implementation of smoke-free zones, smoke-free environments. And first, as I started this presentation, there's no safe level of exposure to tobacco smoke. There's no discussion about it, and there's no discussion about how the exposure to secondhand smoke not only causes death, but also diseases and disability among non-smokers, including children, but also increased healthcare and medical costs in the countries that have to actually treat those persons. Smoking also decreases productivity in those workplaces that are allowed to smoke. That's why it's so important also to ban smoking and the possibility to actually to smoke in workplaces, and only a comprehensive smoke-free laws protect public health, not only of actually people who smoke, but also people who not smoke and are exposed, not non-smokers that are exposed to the smoke produced by tobacco consumers. And in that regard, please don't be afraid to implement these policies in your countries, since comprehensive smoke-free laws even don't harm businesses. It's well proved. There are several studies that have proved that how ban smoking not only not harm businesses, the economies, but also may have a positive impact in the development of those businesses. So I encourage you, all of the countries in the Caribbean region that have not implemented a 100% smoke-free policy yet, to join the rest of their fellow Caribbean countries, since the outcome that you would have from the implementation of those policies will only be positive, and will have a positive impact in people's health and well-being. So that being said, I just want to give you thank you very much for joining me at Campaign for Tobacco Free Kids. Are delighted to or constant collaboration with people in the Caribbean, and we are pretty much looking forward to keep working together towards a smoke-free Caribbean in the years to come. So thank you very much, and looking forward to any question that you may have.
Thank you, Daniel, for that excellent presentation, which really reinforced that this is also a human rights issue, provided a snapshot of smoke-free laws across the globe, in contrast to the smoke-free status in the Caribbean. Danielle, your comment at the end reminded me to remind the audience that if you have any questions, you can use the chat feature, or you can use the question and answer feature. So please feel free to go ahead and do that. So we have a better sense of where we are. Now we look forward. And I would like to introduce this video, which was developed by Danielle Walwyn. She is our advocacy officer, but also she is the lead coordinator for Healthy Caribbean Youth. And this is a very important issue for young people. So really pleased that this was developed by a young person. And this is really the introduction of the tools that you will hear more about shortly. Please go ahead, Daniel.
I'm dreaming about a smoke-free Caribbean. What do I see? Children playing freely on the beach without running into bursts of cigarette smoke and stumbling on cigarette butts. Our most vulnerable communities thriving without being disproportionately affected by tobacco products and marketing from the tobacco industry. Reduce incidence of respiratory issues and related cancers. Our Caribbean moving closer to the 2025 NCD targets, 2030 Sustainable Development Goals, and fulfilling CARICOM heads of government's commitment to a smoke-free Caribbean by 2022. The Healthy Caribbean Coalition, Pan American Health Organization, and UWI Cave Hill's Law and Health Research Unit have developed resources to help our region's leaders to shape this smoke-free Caribbean. Let's make this smoke-free Caribbean dream a reality. Who wouldn't want to win for our health and our environment?
Thank you for that, Danielle. So I'm now going to introduce Mrs. Nicole Foster. She is the head of the Law and Health Research Unit at the University of the West Indies Cave Hill campus. Nicole is the primary author of these briefs that you've just seen introduced, along with Mr. Rashad Brathwaite, who will not be here with us today. But Nicole will present the intersectoral policy briefs and the 2 case studies. And we are delighted to have Nicole share with us her thoughts today. She's going to share with you the legislative approaches that were used in in both countries as she provides a snapshot and overview of the case studies, and also discuss why this is a whole of government approach as she shares the policy briefs. So Nicole, the floor is yours.
Thank you, Maisha. Just let me quickly share my screen. Okay, and all right, let me try this again. 1 second. We tested it, and of course it worked then. And so I'm gonna start from the very beginning. So let me see if it works now. 1 second, just go to the share. There it is. Okay, so hold on, let me see if I can. Is this
It's not full screen yet. No.
It's,
You want to make it full screen? Down at the bottom, there you go. Yeah.
okay, so thank you very much, Maisha. And let me jump straight into it because I only have 18 minutes. So let me take off my watch and look quickly at right. So as Maisha said, the purpose of this presentation is just to give you a snapshot, really, because that's all we can really do in the 18 minutes of the work that would have been done by myself and my colleague Rashad Brathwaite in terms of the policy briefs and our smoke-free environments, as well as the 2 case studies. And I thought it was useful. We've had the big picture, but it's nice to always reinforce that these policies are part of a bigger suite, a bigger picture. And so we're very much here today at the level of smoke-free policy, but we recognize that smoke-free is but one step in many that we have to achieve if we are really to get the benefits fully of the FCTC. So in terms of the intersectoral policy briefs that were prepared, we did 4 of them, 1 on tourism, 1 on the blue economy, 1 on education, and 1 on finance. And what I've tried to do here is just to pull out a few of the key overarching messages and highlights. And so first of all, what's really important for persons to bear in mind is that smoke-free environments is not simply a health issue, but a sustainable development one, which calls for a whole of society government response, just simply because it cuts across all portfolios. And that was very much reflected in our decision to do these policy briefs across a variety of sectors. And so when we look at tobacco consumption and secondhand smoke exposure in the region, we know one of the concerning points that are made in the briefs and in our case studies is that it is a serious problem for our youth. Our youth have some of the highest levels of experimentation with cigarette smoking before age 10 in the Americas. And unfortunately, the use of e-cigarettes is on the rise. Our adolescents, all the data tells us as well that our adolescents have high levels of exposure to secondhand smoke at home and in public places. And that really reinforces why the urgency of us acting and really fulfilling the commitment that our heads have made for us to have a smoke-free Caribbean. Another point to bear in mind is that tobacco consumption and exposure, picking up on the point that Danielle made, tobacco consumption and exposure undermine a range of child rights. So it's also a human rights issue. And in relation to the specific issue of youth, we're looking at rights such as the right to life, the right to health, the child's right to development, the right to survival, education. And we know all the negative health effects that are associated with tobacco consumption. They affect your memory, your attention, the kids' ability to learn, and obviously too as well their quality of life overall, but also useful to bear in mind that nicotine use during adolescence can be a gateway into other addictive drugs. So we see how the tobacco control and smoke-free environments actually can link into the broader social programs that we have in terms of substance abuse and reducing exposure to addictive drugs. Another important part of the picture is the role of the poor and the vulnerable. And we know that the poor and the vulnerable tend to be the principal smokers within a given population, and therefore tend to be the ones that disproportionately experiences negative health effects and economic effects. And this, of course, then perpetuates a cycle of poverty. Then in terms of implementation, if we think about all the benefits that it brings, there are benefits not just to the health, to the smoker themselves, but also to non-smokers in terms of issues such as improved air quality. We're talking about the threat of tobacco to our environment. So we know definitely we'd get huge gains there, but it will also sort of in a broader interlinked whole of government, from a whole of government perspective, it would also help us tackle the issue of our NCDs epidemic, because as Sir Trevor quite rightfully highlighted, tobacco, as we know, is a risk factor for every single NCDs. And we don't have to go through the data in terms of our alarming levels of NCDs. The other overarching message that I wanted to highlight that came out very strongly throughout the policy briefs, but also too in our experiences with the case studies, is that industry interference is a major obstacle. And governments and those in civil society seeking to assist governments in this space clearly have to deal with that head on, accept the reality of the challenge that we have and really strategize on how you are going to seek to counter and neutralize that interference, because it's real, it is strong, and it is pervasive. So it can take up many, many forms. These are just some, trying to discredit the science behind the smoke-free environments, promoting false claims about their impacts, and generally just trying to delay. And so we really do have to have our guards up. And those are some of the key overarching messages. If we switch now and try to pull out a little bit from what we have in the context of the policy briefs themselves, just wanted to highlight in terms of blue economy, tourism, and education, because of course, finance is cost cutting, right? Everything we do has a financial impact, but I just wanted to highlight in particular these three. And so when we think about the blue economy, the policy briefs speak to the fact that smoke-free environments actually help us conserve and actually help promote conservation and sustainable use of our oceans, our seas, and its marine resources. And it does that by helping reduce marine pollution. We know cigarette butts are a major source of pollution, toxicity, and microplastic contamination, and protect the poor and vulnerable fisher folk. We know that our fisher folk tend to be small scale, lower income persons working in the informal sector, and many of them don't have the social net safety nets that would be necessary in order to source treatment, etc., to deal with the negative health effects of consumption of tobacco, but also to exposure to smoke. In terms of tourism, when we think about tourism being our key money earner, we see how smoke-free environments promote sustainable tourism and protect workers within the tourism industry and guests from the health risks associated with tobacco consumption and exposure. It's also important to stress the point that Danielle made earlier, that overall the evidence is clear that smoke-free environments do not have negative impacts on the hospitality industry. And in fact, recent literature, and this is literature importantly coming out of Grenada, demonstrates that even in regions with relatively high smoking rates, poor smoking societal attitudes, and weak social norms against tobacco control, smoke-free legislation did not negatively impact on the hospitality industry revenues. And if anything, it may actually lead to a small positive increase because of the reductions of the cost of the health, but also the absenteeism, the persons needing to go outside all the time to have a smoke, etc. And then in terms of education, and really this is one that is near and dear to my heart, because, you know, the youth are our future, our children are our future, and really we're doing them a huge disservice in terms of our failure to act to protect their health and their long-term development in terms of exposure to tobacco, smoke, and tobacco consumption as well. And we know that in implementing smoke-free Caribbean environments, we would be supporting children's development by avoiding the negative health outcomes associated with tobacco consumption and exposure, of which there are many, ranging from the cardiovascular, as we said. I mean, the US Surgeon General calls tobacco brain poison in terms of when he's talking about its use in relation to children. So that's the policy briefs. In terms of now the 2 case studies, we would have looked at St. Lucia and Antigua and Barbuda, and they both provide useful and interesting experiences. So the St. Lucia case study, which was done by myself, addressed both smoke-free and then also the issue of graphic health warnings and the processes that were involved in passing the legislation for those 2 pieces of implementation. And I just note here that certainly in terms of St. Lucia's experience, their graphic health warnings, the regional process was a critical part of them being able to build up to then rolling out at the national level. But what does this case study tell us? It tells us that political will and industry interference are huge driving factors in terms of, well, huge factors that influence the process. Obviously, political will influences positively, help drive those processes within St. Lucia, and obviously industry interference will act as a hindrance to those. The Tobacco Control Working Group, this was a working group of the NCD's commission of the in St. Lucia, pointing to the importance of those sort of institutional supports, but also the whole of government, whole of society responses. And they were really critical in terms of getting St. Lucia to the point where it was that last year it won the World No Tobacco Day award. And in terms of their legislation, the key piece of legislation here, so they would have amended their main Public Health Act, but in terms of the meat of the regulation of smoke-free environments, we find that in the context of their Public Health Smoking Control Regulations of 2020, noting here that this process of trying to get to the stage of actually being able to roll out these regulations took 5 years. And I just wanted to highlight for you in terms of some of the key features that are really commendable in the context of the work that St. Lucia has done in this space legislatively. We note that they have a broad definition of tobacco products. So the product does include, for example, electronic delivery, etc., of tobacco. And in terms of the prohibition itself is quite broad and comprehensive. There's a prohibition on smoking within a 10-meter radius of public spaces. And public spaces are then defined quite broadly to include, for example, educational institutions. We were just talking about our youth being a high-risk population in this regard, but also to bus stops, public transportation, sport facilities, and I know Maisha loves this one, beaches. So all of these recreational spaces, the St. Lucia legislation speaks to in terms of saying these are now smoke-free environments. Another useful element in the St. Lucia legislation is that it does include whistleblower protection. So it does provide some protection to employees who report employers who are not complying with the legislation. And this obviously will go a long way in terms of providing some level of comfort to persons in terms of not being retaliated against. So that's a quick look at St. Lucia. In terms of Antigua and Barbuda, now St. Lucia would have gone the route, as I said, of they implemented based on specifically Article 8, so smoke-free. And then they implemented specifically on graphic health warnings, Article 11. But what we have with Antigua and Barbuda is a different approach. And so what Antigua and Barbuda decided to do was to go the whole hog. full implementation, a comprehensive tobacco control piece of legislation with full FCTC implementation. Of course, much more ambitious than going section by section. But then, of course, the benefit of this approach is that you leverage all the interconnectedness and all the benefits that come from having supporting other complementary measures in place. So in terms of the Antigua and Barbuda experience, the Antigua and Barbuda Tobacco-Free Initiative was a key player in and driver of this process. They engaged both nationally and internationally, so they would have been involved, for example, in the FCTC negotiations and benefited significantly from those interactions. And I note here, much as we saw with the NCD's commission, the Tobacco Control Working Group in St. Lucia, this is a multi-sectoral committee. So in St. Lucia, I omitted to mention, I should have, this is a committee that is made up of not just health, it is several government departments. So it's health, it's the AGs, it's education, and then also civil society. So really reflecting that whole of government, whole of society response that is encapsulated in or given expression to through NCD commissions. And so very similarly, we have this Antigua and Barbuda Tobacco-Free Initiative, a significant proportion of health persons, but also other players in terms of education, as well as customs and civil society actors. The key piece of legislation here with Antigua and Barbuda is the Tobacco Control Act, specifically Section 9, because as I said, they have a comprehensive act. So if you're looking for the smoke-free provisions, those would be found in Section 9. Note here that this tobacco control legislation was a 10-year process getting to 2018. And it is not actually yet enforced because the regulations, the implementing legislations are currently being finalized. There are a few things to note in terms of the legislation. The Act does not cover heated tobacco products and devices. So that is somewhat of a difficulty because it will not have the same comprehensive cover that, for example, St. Lucia's legislation has. But in terms of the regulation of the smoke-free, it provides that it is an offense to smoke tobacco product within 15 meters. So no, St. Lucia was 10, Antigua ups the ante a bit and takes it out to 15 meters of any enclosed public space or enclosed workspace, public conveyance. And they have very similarly the same sort of broad coverage in terms of childcare spaces, recreational spaces, educational spaces, etc. And the persons responsible for these spaces do have a continuous duty to post the no smoking signs, as is the case in St. Lucia. Now, two areas of concern in terms of the last amendments that were made to the tobacco control legislation before it was signed off on is unfortunately the tobacco-free initiative can now include a legal manufacturer or representative from the private sector. That of course raises some concerns in terms of potential conflict with Article 5.3 of the FCTC. And then the definition of the tobacco industry in the legislation was adjusted to exclude wholesalers and distributors and refer only to tobacco manufacturers. But of course, there are no manufacturers of tobacco in Antigua and Barbuda. So there's potentially quite a significant limit on operation of some of the provisions there. But as we said, the Antigua and Barbuda is in the process of rolling out regulations to implement the smoke-free, to implement their Tobacco Control Act. And it is hoped that perhaps there may be some space to address some of these difficulties at that level. And so wrapping it all up, what are the lessons that we have learned? Legislative change takes time. It takes time and it takes a lot of resources. So we have seen that it called for both Antigua and Barbuda and St. Lucia, there was the need for deployment of significant financial and personnel resources. And therefore, you may have to make some strategic calls about how you allocate those resources. And certainly even then, the additional support from international partners was also still quite important. Bloomberg Philanthropies, PAHO, etc., were key players in supporting these processes. Legislative change, as I said, takes a lot of time. So depending on the route you take, it's going to take longer. So St. Lucia was able to deliver their smoke-free in 5 years. Why? Because they chose to just focus on implementing the smoke-free as opposed to trying to get the comprehensive legislation, which addresses multiple issues and therefore takes a longer consultation time. Of course, the downside of that is you don't have the complementary measures. Antigua and Barbuda, on the other hand, of course, went the comprehensive route, but of course, then that took them a 10-year process, and we're still trying to get it fully, rolled out, so to speak, because of what is entailed. It is so much. It's quite a mouthful in terms of implementation and the types of resources that is needed to really bring it to life. The other important lesson throughout both was the importance of evidence. Evidence base is critical for both the content of the work, the legislation itself, but also to encountering industry interference. So you need to have your dots lined up there and be able and ready to engage and counter and show how conflict of interest-free legislation of studies show other than what the industry would be trying to convince government of. And then most importantly, and this is standard for the NCD space, we know that political support and political champions, policy champions, more broadly, are critical. So we saw how in the context of St. Lucia, the NCD's commission stroke their tobacco control focal point, the working group, was able to really drive this process and create the necessary sort of support in terms of engagement with the public, etc. And similarly in Antigua and Barbuda, you had the Antigua and Barbuda Tobacco Free Initiative. And what you would find is consistently then, once you had persons trying to come in and upset the apple cart, so to speak, they were able to sort of keep it on track because they were strongly grounded in terms of the support and the analysis that they had done. So that's it, ladies and gentlemen. Maisha, I believe I'm just about on time, or maybe a minute or two over. So I end here.
Thank you, Nicole. That was excellent as always. We're short on time, so I'm going to hand over quickly to Ms. Joanna Joseph Henry. She is the Tobacco Control Focal Point at the Ministry of Health in St. Lucia, and she is also the Deputy Director of the Substance Abuse Advisory Council. And she's going to provide some remarks, taking a closer look at the legislative process around the tobacco control legislation in St. Lucia. So over to you, Joanna.
Here I am, and I'm being heard quite clearly, I hope.
We can hear you loud and clear.
All right, wonderful. Thank you so much for the opportunity to speak briefly. And I really want to say thank you to Mrs. Foster, for her work and her very adequate description and analytical description of our process. So in brief remarks, I just want to point out, in addition to the Tobacco Control Working Group, which we really cannot congratulate enough for their support, all of those members, and as Ms. Foster mentioned, this was a whole approach. This really provided the space that was needed to undertake this work that was done. I mean, we do not have a tobacco control unit. It's myself as tobacco control focal point, supported by wonderful program officers. But with the tobacco control working group, all of a sudden our reach was extended. And so I would really encourage any country within the Caribbean. We know that the human resource and financial resource provision is necessarily very limited. But if you have a group of supportive people and you have the right mix of skills, the right mix of interest, the right mix of interest groupings, then you can go really, really far, as we discovered. So with our Public Health Amendment Act, which started in 2019, and then our regulations in 2020, I think we needed to go a little bit further to just explain what drove this. But this didn't just come from nowhere. And so what really helped us to set the strategy and to recognize where we needed to make legislative changes and where we needed to go with other measures was the Empower strategy. So for us in the Caribbean, well, in St. Lucia, I can speak for, this really helped us to chart a way forward. And so I was just looking at it today and I realized we've covered at least 4, maybe not completely, but very substantially, the first 4 measures of Empower. And as we move on, I think one of the panelists already discussed what's happening with Cross-Q and the ban on tobacco advertising. So St. Lucia, with the Bureau of Standards, I believe is still the secretariat on this initiative. So we should see this coming along. And also we have a very interested advocate within the Ministry of Finance so that we can start looking at raising our taxes. So wider than this, remember, we saw the need both from our monitoring, what we saw happening with our global youth tobacco survey, what's happening with our students, what's happening also from some of the adults in our STEP survey. We realized that even if tobacco use, cigarette, just to specify, cigarette use had been decreasing quite substantially in St. Lucia, something else was happening with NCDs. So we realized we needed more of a comprehensive approach. So while we have tried to fast track and to put certain things in place that I love to quote our former CMO, Dr. Frederick James, as low-hanging fruit, we have not stopped there. With the assistance of the union, and Jorge was on board. It was so nice to see Jorge again and to hear him speak. Jorge from the union was actually our technical advisor. We actually do have a final draft of our tobacco control policy, national tobacco control policy that will be going forward. And this is going to hopefully be approved by cabinet. We are very optimistic because of the standard at which this policy is and the St. Lucian-ness of it, while maintaining the FCTC principles. And so this is going to give us the means of going forward in terms of comprehensive legislation. We do not want to see legislation passed and sitting on the shelves. So we need to be able to strengthen our control resources, our networking, our structure especially. This cannot be done effectively with one tobacco control focal point, which is sharing, who is sharing many other duties. And so there's a proposed structure to really widen and solidify our tobacco control policies. Now my time is up. So I want to just encourage everybody to continue this work. I loved Dr. St. John's vision. I went there with her, and we can do this. We can do this with a lot of footwork. We can do this with partnering with each other, and most of all, just not giving up. This is really important work that we are doing, not just for ourselves, as Nicole mentioned, Ms. Foster mentioned, but for our generations. I have a child, I have a son, I have nieces, I have nephews. And so I'm just as much invested in this as everybody. So thank you everyone for this opportunity to share. And I look forward to continued support.
Thank you, Joanna, for your wonderful comments and congratulations to you. I mean, we've done collectively as a group, everyone hosting this webinar, a lot of work around what are the barriers to policy acceleration in the Caribbean and what are the facilitators? And one of the key facilitators repeatedly is leadership and individuals who are passionate and help to push these policies through. And you are one of such leaders. So thank you very much. We are nearing our final session now, and this is going to be hosted by Mrs. Barbara McGaw, Barbara is the Tobacco Control Policy Advisor at the Healthy Caribbean Coalition. And she's also wears the same hat at the Jamaica Coalition for Tobacco Control. And she's also a champion and regional advocate for many years. She has been around the block, so to speak. She is going to be moderating the next session, which is entitled The Role of Civil Society in Facilitating and Moving Us Towards 100% Smoke-Free Caribbean. So over to you, Barbara.
Okay, thank you. Can everyone hear?
We can hear you. We can't see you yet, but we can hear you.
Yes, my camera is on. Can you see me?
No, we're not seeing you, Barbara.
But I'm seeing myself.
I think it's your dual. That's fine. We can see you in one of the images. That's fine. So go ahead.
Okay, perfect. So thanks, Maisha. I'm going to be really quick because we are running a little behind time. I wanted to introduce the esteemed panelists that are here for this section. Dr. James Hospitalis, the founder and managing director of Earth Medic. Ms. Doriel Kintyre, youth tobacco activist and health from the Healthy Caribbean Youth. Unetta Bird, a member of the Antigua and Barbados Tobacco Free Initiative and Breast Friends Antigua. And of course, Ms. Nicole Foster, who was already introduced. So the aim of the session is really to discuss the strategic role that civil society can play in advancing the enactment, implementation, and enforcement of smoke-free regulation. Sorry. So I just wanted to quickly talk a little bit about civil society, defined as a sector composed of the totally voluntary civic and social organizations and institutions. They have been the engine that has permitted many of the accomplishments seen in public health in the Caribbean, and especially in tobacco control. The groups have had a strong record of providing service and public education, traditional linkages with communities that have harnessed to influence social behavior. I would say without the support of civil society, programs developed to tackle NCDs, including tobacco, would not be very successful. We want to put on record our thanks for the support of TFK and the union, who have supported important advocacy work over the past years in terms of advocacy. So the roles, we're looking at the several roles of civil society: advocate, coalition builder, provider of evidence-based information, watchdog, and service provider. But advocate, coalition builder, and watchdog are the ones that will reap the most benefit in terms of public health and tobacco control. So being a technical resource for tobacco control activities, holding sensitization meetings, working with key leaders, signing petitions, getting out there in the press, both social media and the traditional media, countering claims by the tobacco industry. This is one that's very, very important. Garnering support from other key organizations and identifying tobacco control champions, which we have. For example, in our previous administration, we had Dr. Fenton Ferguson, and he has been fantastic. He really supported that first regulations. And now we have Minister Tufton with the Tobacco Control Act. Identifying and developing allies in the government and opposition. So in terms of coalition building networks, alliances, and coalitions makes civil society more powerful and sustainable. And JCTC has been able to support several alliances, throughout the Caribbean. The watchdog role is important. Oh, I just wanted to mention using special health dates to highlight the impact of tobacco use, like today for World No Tobacco Day. But I'd like to note that today is World Vape Day. And they have a webinar for 3 or 4 hours with many presenters. And it is put on by the World Vapers Alliance, deliberately done the day before World No Tobacco Day. So coalition building, we talked about. So it's very important to hold the governments accountable. And as civil society, because we are not linked, we can. We support implementing and monitoring tobacco laws like we're doing now, monitoring the activities of the tobacco industry, naming and shaming. The coalition is known for that. If we find a breach and we see it, we will present and we will submit to the government, write letters, and have petitions and so on. Using the Access to Information Act. This is something we have done to highlight breaches of the Framework Convention. And of course, providing information and shadow reports for international organizations such as FCA and Inter-American Heart. I also want to talk about working with our international partners throughout the world, both global and regional. And they have been able to help us many times in terms of challenges we have had with tobacco control. Okay, so just to go into now, I'm going to ask some questions for our 4 panelists. And we're asked to have 3 minutes each. Hope that can work. So the first is to Dr. Hospitalis. The theme for WNTD 2022 is protect the environment. Smoke-free legislation has co-benefits for humans and planetary health. You recently started EMEN, which is Earth Medic, Earth Nurse. Can you elaborate on the environmental case for a smoke-free Caribbean, especially within the context of SIDS such as ours?
Thank you, Barbara. Good morning to everyone. When I was a medical student in Trinidad, a long time ago, one night I admitted to hospital a man who had a heart attack. On approaching him, I saw he was smoking a cigarette. And I asked, hasn't anybody told you smoking can cause a heart attack? And he replied, somewhat surprised, no, doc. I know cigarettes cause cancer, but not a heart attack. But he stubbed it out. That was one experience that led me to focus on NCDs in my career. But in focusing on NCDs, I was like that man in the sense that I was not aware of the extent to which tobacco damages the environment. However, in my journey to found Earth Medic and Earth Nurse, which aims to mobilize health professionals to address the climate crisis, I had an aha moment when I learned that as well as damaging human health, tobacco is nasty. It's extremely damaging to the environment in all parts of its growing, manufacturing, distribution, and use. As climate change becomes an ever clear and present danger to SIDS, people focusing on achieving a smoke-free Caribbean could benefit from the advocacy of the millions of young people who are frightened at what is happening to our world through climate change. So I think the theme of this World No Tobacco Day 2022 is spot on, bringing together people lovers and tree huggers, if you will. The environmental case for a smoke-free Caribbean world is clear. Tobacco releases a lot of toxic air pollutants, cigarette butts litter and poison animals, plants, fishes and aquatic life. They litter the beaches. The deforestation associated with clearing rainforests for planting tobacco causes soil erosion, loss of soil fertility. A lot of wood is used for cigarette paper and for burning or drying the tobacco that adds to the greenhouse gas emissions. And the toxic pesticides that are used in tobacco farming commonly, like aldicarb, are persistent organic pollutants. An issue that pains me personally is bushfires or wildfires caused from thoughtlessly discarded lighted cigarettes. As climate change brings hotter, drier weather to the Caribbean overall, bushfires are becoming more frequent, lasting longer, spreading further all over the region. Beside the immediate damage, come rainy season, this means more floods, more landslides. I conclude by encouraging a continued joined-up approach of the NCD and tobacco agenda with the climate action agenda for mutual benefit, including common approaches to the commercial determinants, as the tobacco companies and fossil fuel companies are using the same tactics that put profit before people or the environment. I thank you.
Okay, thank you very much, Dr. Hospitalis. Very succinct. I love it. The people lovers and the tree huggers getting together. That's so important. So, Ms. Doriel Kintyre. Doriel, why is tobacco legislation important for young people? And how can we leverage links with the environment to build youth support for tobacco legislation? Over to you.
Thank you, Barbara. Thank you for inviting me to share the youth perspective, because young people are especially vulnerable to tobacco marketing and advertising, as the tobacco industry recognizes that youth are essentially their source of replacement smokers. And the Caribbean has the highest rates of youth smoking in the region of the Americas. And this is a worrying trend because of the known health implications that we know of, like nicotine addiction, cardiovascular and lung damage, and the effects on the adolescent brain development. And the issue of electronic cigarettes also needs to be urgently addressed, as vaping has become quite popular among youth in the Caribbean, and the vape use is continually rising, and smoke-free legislation needs to encompass not only cigarettes, but vaping as well, so that we can create environments that are truly smoke-free. I designed the Youth Tobacco Advocacy Portal on HCC's website, which highlights this data and the legislation across the region, which impacts young people, because we cannot exclude young people from the legislation process as it directly impacts us. Youth who are given opportunities to contribute to tobacco control efforts can also improve the acceptance of these policies by their peers and can help build smoke-free communities that will positively impact future generations. And policymakers should leverage the support of key stakeholders like the youth for the implementation of smoke-free legislation. And they can link the detrimental environmental impacts of tobacco that Dr. Hospitalis shared with us. Young people are very passionate about the environment, climate change, and pollution, and we can build even more youth support for tobacco advocacy by tying in environmental advocacy. Millions of cigarette butts are collected from beaches and waterways annually, and e-cigarette waste poses an even greater problem because it can't biodegrade. And I think youth environmental advocates should be included and can call for the tobacco industry to be held responsible, and their involvement will no doubt increase youth support for tobacco control policy. Thank you.
Thank you so much. That was excellent. I just wanted to pick up something you said. The youth are here as replacement smokers. And I wanted to point out that the Global Youth Tobacco Survey, which is around the Caribbean, I can speak for Jamaica. The e-cigarette use in Jamaica with our youth is higher than the regular cigarette use, you know? And so, you know, I really endorse that point. Congratulations on the web portal. I've seen it. It is excellent and very interactive. So now we're going to ask Unetta Bird. The DHCTC in Jamaica and the ABTFI are examples of powerful national coalitions that have played a significant part in the tobacco control story. How did Breast Friends become involved in the Antigua and Barbuda Tobacco-Free Initiative? And why was the initiative so important in supporting the advancement of tobacco control legislation in Antigua and Barbuda? Over to you, Unetta.
Thank you so much, and thank the organizers of this webinar for inviting me to participate in this forum. And I also count it a privilege to be representing the Antigua and Barbuda Tobacco-Free Initiative and Breast Friends, which is a cancer support and awareness organization in Antigua and Barbuda, of which I'm the sitting president. It's a non-profit, non-governmental organization, and our aim is to provide emotional support to breast cancer patients and to promote breast health. I'm also a breast cancer survivor, bordering 24 years. Now, Breast Friends became involved with the Antigua and Barbuda Tobacco-Free Initiative in 2012 in response to an invitation letter from the Permanent Secretary in the Ministry of Health for a representative from Breast Friends to serve as a committee member on the ABTFI. I then participated in a workshop pertaining to the modification of the proposed Antigua and Barbuda Draft Tobacco Control Act. There I became aware of the WHO Framework Convention on Tobacco Control. The health aspect was what really ignited the passion, interest, and the willingness for Breast Friends as a cancer interest group to lend its voice to raise public awareness about the dangers of the use of tobacco and tobacco products. Also to highlight the risk of developing cancer and other non-communicable diseases posed by smoking directly or indirectly. Now, the initiative was important in supporting the advancement of tobacco control legislation in Antigua and Barbuda. because the creation of the ABTFI was the first important step towards achieving the implementation of the WHO Framework Convention on Tobacco Control, to which Antigua and Barbuda is a signatory. It also presented an opportunity to raise public awareness about the dangers of tobacco use and the consumption of its products, which evidently may lead to lethal diseases such as cancer and heart disease. Through our anti-campaign marches, walks, our health fairs, our media campaigns, both through radio, television, and social media, engaging the schools on a regular basis, and also engaging religious bodies. As an independent body, we can hold the government accountable for the health of its citizens and residents. Though smoking is not generally considered as an ingrained part of our culture, the ABTFI considered taking a healthy lifestyle approach in light of evolving health concerns linked to chronic non-communicable diseases. ABTFI advocates the policymakers for legislative change. We serve as a pressure group, securing small incremental ways, which ultimately led to the passage of the Tobacco Control Act of Antigua and Barbuda in 2018. In 2017, prior to the passage of the act, ABTFI played a significant role in defending the legislation in the face of interference from the tobacco industry. The most notable achievement in tobacco control in Antigua and Barbuda is that the Antigua and Barbuda Tobacco Free Initiative, with the support of civil society, in this case, Breast Friends, played a key role in effecting legislative change by lobbying the government to adopt effective policies to reduce smoking and other tobacco use. This legislation is 100% smoke-free indoor workplaces and public places, ban on advertisement, promotion, and sponsorship of tobacco products, and the compulsory use of graphic health warnings, which must cover 50% of the principal display area. The Antigua and Barbuda Tobacco Control Act was passed in the House of Parliament on the 1st August 2018, and it is a document that the people of Antigua and Barbuda are very proud of. The Antigua and Barbuda Tobacco Free Initiative and Breast Friends are extremely happy of the contributions that we have made towards a tobacco-free Caribbean. Thank you.
Thank you so much, Unetta. Your presentation is a perfect example of what we're saying, how important civil society is as a driver, because once you have committed and passionate civil society, we can make a change and we can help to move the process forward. So without further ado, I'm going to just ask Ms. Nicole Foster her question. What can the Law and Health Research Unit at the Caribbean Public Health Law Forum do to support member states in fast-tracking smoke-free legislation?
Thanks, Barbara. So, well, I guess we just continue doing what we're doing currently. So the idea is to help persons understand the importance of law in this process. So to understand that these issues are not simply medical issues or health issues, that they are issues where law plays a role, and therefore they do need to engage with and discuss with legal persons in terms of the types of tools and ways in which we can get to that space. In that regard, you know, intersections with AG's chambers, but also to academics in the space. And that is obviously where, for example, the Law and Health Research Unit and the law faculty at UW Cave Hill comes in. So we do try to support research and analysis in this field to help build that capacity in terms of persons understanding the interconnections, but also to something that came out very strongly in going through the case studies, for example, is that we often don't have a good understanding of, well, non-legal persons don't necessarily have a good understanding of the legal process and the legislative process, what's entailed, and therefore how, because that's important for you to engage effectively at each level and to understand that, okay, when we've passed this hurdle, it's not the end of the game. You know, there's still another 2 hurdles down the road that they could still reverse it in this way. And so certainly those are important ways that both the Law and Health Research Unit as well as the Caribbean Public Health Law Forum can assist in terms of just building that understanding and awareness of the interconnections, one, but two, helping to identify the points of entry based on persons better understanding the legislative processes. And something that comes up all the time, the difference between the different options. So for example, you might choose to go a policy rather than legislation, you know, so those types of information that really empowers governments and the players, stakeholders supporting those processes to really make the best choice based on their circumstances, their goals, and the resources that they have available to them.
Okay, Nicole, that's great. Thank you so much. So I heard you say, keep on doing what you're doing. The importance of law and of course, policy, you know, even though it may take a time to have it implemented, policy is key. So we need to move for that. And a very important part you talked about was building capacity because people are not aware of the law. And I would actually even say the other way in terms of law, some persons may not be aware of the public health implications. So it's 2 sides of the same coin. So I'm
Absolutely.
going to
I agree 100%. It's
right, I'm going to both ways. So I'm going to hand over back to Maisha. Thank you so much to my panelists and my presenters.
Thank you, Barbara, for excellent moderating, demonstrating why you've been around for so long and the knowledge and the expertise that you have, making all of those connections. Very shocking to hear that today is World Vape Day.
World Vape Day.
Very, very shocking indeed.
Look it up. Go on the website and put World Vape Day. You'll see everything.
Yes. So we're over time, so I'm going to wrap up. I want to thank all of our partners who provided brief opening remarks, all of our panelists, and I'd like to extend a personal note of gratitude to Dr. Lisa Prieto, who has joined us, and Cheryl Dennis Wright, and Dr. Kavita Singh. These are PAHO colleagues who invited us to participate or partner on this work about a year ago now. And thanks again to Nicole for the excellent work that she did in putting together the case studies, her and Rashad Brathwaite and the country partners who responded. Thank you to Barbara, who worked with us as well on the case studies. So a real kind of cooperative effort, and we are very pleased the final product and really hoping that they can help member states to move forward with the accelerated implementation of smoke-free legislation across the region. So with that, we're going to close now. Thank you all for joining us. We hope you enjoyed it. Please stay tuned for more webinars. Thank you.
Bye. Thank you, everyone.
Thank you.
Thank you and congratulations.
Thank you.
Thanks, everyone.
Have a great day.